Hi friends, it's Paul Ward and welcome to On the Road. I'm excited today. We are in Oxnard, California at the Wellness Center, and I'm sure you've heard in the news lately and on the internet a lot about mental health. This was a topic that was kind of swept under the rug for many, many years, but now it's more out in the open. And who better to talk to us about that than our current guest, Tyler Nash with the Wellness Center. Welcome to On the Road.
Thank you for having me.
Absolutely. And of course, we want to thank our sponsor, Opus Escrow. So what is the mission of the Oxnard Wellness Center?
The Wellness Center, if I could kind of put it in one phrase, it's we are trying to create a space for people to receive services who are maybe otherwise not being reached in our county. And it's usually due to the fact that they either don't have the resources to seek treatment, or maybe they have some type of personal barrier. As you mentioned, it's something that for so long has been swept under the rug. Mm-hmm. And we're really trying to destigmatize mental health and turn it into something where people can come in, hear about it, talk about it, and it's a safe space to do so.
Would they hear about it from peers? Would their family member kind of drop them off? Would the police bring them by? I mean, how do folks end up here?
Could be a variety of ways for certain. I always try to do plenty of outreach out of the community and let people know about who we are and what we provide. We do get plenty of referrals from other caregivers, whether it's a medical professional or a behavioral health professional. And and word of mouth through peers, right? People start to learn, hey, there's this place down here in South Oxnard you can go to. It's a great place. You should check it out.
Mm-hmm. And I hear that they could just walk in. They don't need insurance. They don't need to have any money.
Correct. Yeah. All of our services are entirely free. You do not need a referral. You do not need insurance. You do not need a payment. You don't even need an ID.
Wow.
All you need to do is just show up, sign up as what we like to call all of our people here members, right? We're not trying to think of them as clients or patients or any of those kind of words. They're members. They're members of a clubhouse.
Nice.
And they sign up and they show up, and 5 minutes later, you can be sitting here receiving services.
Wow. And so the members come during the week, and then they have different activities, but also kind of getting assistance with their mental health challenges.
Yeah. So we're open Monday through Friday during the day, and we offer groups, we offer one-on-one counseling services with our staff, but all of it is voluntary. And because it's a clubhouse, we can kind of provide a space where maybe one person's attending a group and someone else is just hanging out. We've got couches, we've got games, we've got pool tables, art, we have food. Some people are just kind of coming in to hang out, and it's a safe space and they know that they can be here. And, we're still going to try to make an effort to reach those people and see if there's any way that we can help them. But maybe somebody just wants a space to be for the day, and that's okay too.
So if somebody was getting, I don't know if the right term is diagnosed, how would that work? So they come in, they register, and then one of the staff members starts to sit down with them and kind of discover what their challenges are?
Yeah, so we definitely don't diagnose anybody in here. They may have received a diagnosis from another provider or something like that. And if they do have insight into the fact that they have a diagnosis, they might be able to talk about that here. All of my staff are what are known as peer support specialists. And what a peer is it's an individual with lived experience in the behavioral health system, meaning that they are somebody who has received mental health and or substance abuse services in the past. And they are able to share openly and honestly about their experiences in a way that help other people develop hope. Again, that word destigmatized that I bring up a lot, right? To kind of say, hey, here's a person who is sharing and saying, yeah, I have a diagnosis and I received help for that. And maybe I took medication, or maybe I saw a therapist, or maybe another peer just like me helped me get well. And for a lot of people who come in here, this is the first time that they're ever hearing somebody else openly admit that.
Interesting.
And feel okay about it and no shame.
Okay to talk about it. And this is how I got through that challenge, and you can get through it too.
Exactly. Yeah. But we want to be really firm about the fact that just because our staff have their lived experiences, that doesn't mean that that's what the other person has to do, right? everybody here is the expert on their own story, and they know deep down perhaps what they need to do to get well. We're just here to share about what we did and what we're doing currently in our recovery journey.
And I would imagine that some people come and stay for a little while, maybe a week, a month, and other people, you've seen them for a year or two.
Years, multiple years, absolutely. Yeah. No, there is no end date to your time at the Wellness Center. If you want to be here for the rest of our time that we're here, then you are more than welcome to do so. Yeah, we've had people who have been enrolled for a very long time.
So how does the collaboration work with other entities then? So this is kind of a safe place for folks to come Monday through Friday, but they also have maybe some are living in some type of shelter environment. Maybe some are living with their parents.
Yeah.
How does that work in terms of collaboration with other to get these folks kind of on the road and to kind of functioning in society?
Sure. Well, if they are enrolled in any other kind of service, we would absolutely collaborate. If the member would want that, they can sign like a release of information that would allow us to communicate with their provider. We've had people who would come here, maybe they receive services at a place once a week where they get their medication and things like that. And they'll come to us and they'll say, boy, I'm having like a mental health crisis right now, whatever that might look like for them. And we'll say, okay, should we maybe get in touch with that other medical provider of yours? And we can try to work on it together. And, we've taken people to the hospital. We've taken people to go meet with their provider and have a crisis assessment done on them. So we really try to be a place where, and that's the way that I kind of pitch our place to other healthcare providers, is we can kind of be an eyes and ears on some of the people who you're referring over here. If you do refer over here, again, not required, but, we can be that extra set of eyes and ears on our people and get a chance to interact that way. When it comes to like any other kind of, if it's like a housing program or, like you'd mentioned, like family or something like that, again, it's really on the member to decide how much, connection they want between us and them. Some people, they don't want that, right? It's like, no, I'm coming here and this is my safe space. I don't need other people involved. And other people are like, yeah, I would like you to communicate with my mom. I'm learning so much about myself and my mental health, and I don't think my mom understands these things. Would one of you guys be able to talk to them about that? And yeah, we could definitely provide that kind of connection.
Interesting.
Yeah.
And is this idea of the wellness center, is it new? I mean, I've never heard of an entity where folks just walk in and they don't have to pay.
Yeah.
I mean, that's pretty amazing.
Yeah, it is very amazing. And we're very fortunate to get the kind of funders that we have to keep this place open. We are not new. We've been around for about 10 years. It's very unique, and you're not going to find, you might find some places where you can come in for free. You might find some other places where they offer the scope of services that we offer, but it's going to be very rare to find that connection between the two things where it's free and you've got these scope of services that you can receive from our peer support specialists.
Right. How did the concept come together of the Wellness Center?
So the Wellness Center, I'm not a historian on the full concept of the Wellness Center, but there were a lot of people who, first of all, wanted a place like this where people could come in and receive services where they wouldn't have to pay. It's a way to, again, try to reach people who aren't being reached otherwise, right? Maybe this is their first foot in the door. And so, they wanted a place like this because it could be a place that's more accessible. Sometimes the biggest barrier that people have towards seeking mental health is that it can be a process, right?
Sure.
You got to go through an intake and you got to have this appointment and do this and that. And
you might not even know that you have a problem in the beginning.
Exactly.
It's like, well, why am I thinking the way I'm thinking?
Right. Yeah. It's like, that's even assuming that they realize that there's something that needs to be done, right? Maybe they realize that something's not quite the way that they want it to be, but they can't really put their finger on it. And so again, hearing it, the peer movement has been something that Turning Point has been a part of for a long time, even before the Wellness Center ever became one of our programs. We have always believed at Turning Point Foundation that peers are uniquely qualified in some ways to help people, like you said, who maybe are kind of in that early stage. They don't always have the insight. They don't always have the ability to just say like, I know what I need, and here's what I'm going to do, and I'm going to get up tomorrow and go seek help, right?
Right.
Peers are really uniquely qualified to help people that way because, number one, they've been there too.
Mm-hmm.
They know exactly what it was like, and I tell my staff, remember what it was like for you before you were ready to get help.
Mm-hmm.
How could somebody have still reached you at that moment,
Mm-hmm.
And number two is I think peers come across as a little bit less intimidating.
Mm-hmm.
They don't have the white coats. They don't have all the fancy letters after their name. They don't have, there's no like diagnosis. We don't talk about diagnoses here. We don't talk about medications here, or at least we might talk about how people take medication to help them, but we certainly wouldn't say, well, you should be taking this medication or that medication. All of that is out of this place.
There's no judging.
No judging.
Yeah.
No judging. And it's a place where it's open dialogue, but there's certainly no labels being put on.
I would imagine people in their outside world are judging all the time.
Oh, yeah.
This is somebody that's got a mental illness and there's still the stigma, right?
Yeah, there's still the
And you come here and it's the opposite.
Yeah. Yeah, no, there are tons of reasons why there's that judgment. Some of it is just historical, right?
Mm-hmm.
Some of it is cultural. We're here in South Oxnard where there's large populations of Spanish speakers and, migrant families coming in. And a lot of them tell us, in my family, we don't talk about this kind of stuff,
Mm-hmm.
And so it's eye-opening for them to even hear these words coming up.
Right.
Right.
And I hear you have a mobile version now too.
Yeah.
Actually going to them. They're not on you.
Yeah. So basically a couple of my staff, we have agreements with different kind of programs out there. They're all housing programs. So it might be a board and care. It might be a homeless shelter. It might be a transitional living center. And we go there and we do groups at the centers because these are people who are probably in some of these situations because of behavioral health challenges that they've had. And although the housing is amazing for them, they're not necessarily getting any other kind of mental health support while they're there.
Interesting. So they've got the roof over the head and the warm bed and three meals a day, but whatever's going on in their head is not being helped.
Yeah.
Interesting. So you go to them and help them with their other...
Try to help them keep that housing.
Yeah.
Right. Because that's half the battle,
right?
For a lot of these
don't
people.
End up on the street or
don't end up right back where they started,
right?
Yeah.
So the folks that work here, the peers, and then the professional folks that have some letters behind their name, which you mentioned earlier. How does that work in terms of their interaction and then with the members?
Yeah. Well, as the program manager, I have a master's degree in social work. I am the only person on the staff who has a master's degree. And again, it's because we're trying to keep this place kind of purely peer, where, it is only peer support specialists working here. But I do want to be clear that a peer support specialist still has some training and some education and everything like that. They're not just grabbed from off the streets, right? So there is a certification process for peers. They go through a very rigorous training process, and then they take a state certification exam. So in order to work here, they have to go through that process. We also do a ton of on-hands training with them to learn some basic kind of counseling skills. And we also have them trained in evidence-based practices. An evidence-based practice being something where there is actual research showing that if you do these practices with the clients, this kind of intervention with the people receiving services from you, they will get better. And the main one that we do is called Wellness Recovery Action Plan, or WRAP. It is a evidence-based practice that was intended to be led by peers. And I could get all into WRAP for you if you want, but to kind of keep it focused on the question that you asked, they are trained and certified to lead those groups as well. The cool thing about a lot of my staff is that some of them started as somebody receiving services here, right? And they came to our center at whatever place they were at, and they started to take our WRAP classes. And really what WRAP does, there's 5 kind of key concepts that you learn with WRAP that kind of helps develop the whole plan that you put in for yourself. It's hope. Again, having hope that you can get better.
Right.
personal responsibility. Nobody is going to make you get better except for you, right?
Yep.
And you are the person who needs to take it. If you want to get better, that starts with you, right? Education, i.e., I need to learn what is out there to help myself, right? I need to do the research, as they say, right? And figure out like what's out there and what fits for me. And then when I say what fits for me, it's because it's with the next principle, which is self-accountability, right? Again, like I know what I need to do, and now I am going out and taking care of it. And then the last thing, and then this is where this place comes from, support. Nobody can do this alone, right? And those 5 key concepts are what make up RAP.
Interesting.
And everybody puts together their own personal action plan, and by the end of it, they get themselves into wellness. So we have staff members here who were in very low places when they first came in here. And because of RAP, they were able to really get themselves to a place where not only did they feel like, stabilized, or whatever word you want to use to describe somebody in wellness,
right,
but they really have insight into themselves and what they need to do.
Interesting. So the process is the same for everyone in terms of the 5 steps of RAP.
Yeah.
But then the plan is individualized for that specific person.
Exactly. Everybody's RAP plan is going to look different. There's no cookie cutter RAP plan. And the way that we facilitate RAP is very much valuing the dignity and worth of the people who come in here. So they might come in and say, hey, for me, something that works is, and it's going to sound totally out of left field, right? But we're going to say, hey, that sounds great. If that's what's working for you, that's great, because there are no 2 people that are totally alike.
And then you see those changes over time.
You do. Yeah, you do. RAP is an evidence-based practice. Like I said, people do get better if they follow it the way that we lay it out.
Wonderful.
Yeah. And our staff are testimonies of that. They sit there, when they facilitate RAP, they say, okay, now we're going to get into this next section. Here's what's in my RAP plan.
Right.
Right.
They lived it.
Yeah.
Right. And so they're helping others.
Exactly.
achieve it.
It's really one of the only evidence-based practices that you'll ever see where you telling your story and highlighting how you do the things in this plan is part of the evidence.
Interesting.
Yeah.
Is this something unique to our county? I mean, I don't think that there's a lot of walk-in places in other areas.
I don't know. There are other walk-in places in our county, but I don't believe that there are other walk-in places that then in turn can provide the full depth of mental health services that we can provide.
And then you've got the mobile version.
And then we have the mobile version, right,
Yeah.
where we can go out for free again,
Right.
and provide groups to people living in these places just by showing up.
Yeah, that's amazing.
Yeah.
So the big curiosity is, how is this program free?
Yeah. Our funding comes from Ventura County Behavioral Health with MHSA funding, Mental Health Services Act, which you may have heard of, which is kind of colloquially referred to as the millionaire's tax, right? We get our money through taxes that are used specifically to fund mental health services. So they're able to keep this place open every year through that. The thing that I just tell people, if they want to know, like, is the wellness center right for me, or is am I at the right place? There's no such thing as the wrong person to come to the wellness center.
Right.
I highlight the fact that we can help people who aren't quite yet there in their mental health journey, but maybe there's no such thing as the wrong person to walk in through our doors. Maybe somebody's just looking for a friendly face to come in, have a chat, and have a warm meal, and we're there for that. You can want to attend every single group that we do throughout the day, or you can want to attend none of them. And guess what? You're still going to get a lunch. You're still going to have a place to sit down. You're still going to have something to do. And so there is no wrong referral. There is no wrong person for our program.
Yeah. And again, no stigma, no judging. Just come in here and have a safe place to hang out if that's all you want.
Yeah.
Wonderful.
Yeah.
Well, Tyler Nash, thanks so much for being our guest on this On the Road.
My pleasure.
Love learning from you and having you.
Thank you for having me.
Absolutely. And of course, we want to thank our sponsor, Opus Escrow, and be sure to tune in next time for On the Road.